Hi, my name is Dr. Elena Itskovich, and I'm an advisor with EndoCure. The company is based in Israel. I need you to think of a moment in time when you experienced very severe pain. Maybe it was an injury, a migraine, something that really affected you. And now I need you to imagine experiencing that pain day in and day out. And you go to the doctors, and you go to the specialists, and you go and do imaging analysis and blood tests, and nothing works. And it takes 11 years until you undergo an invasive procedure until you finally find out what's wrong. You can stop imagining. That's what happens to 200 million women worldwide when they're suffering with endometriosis. If you don't know, endometriosis is a condition where tissues similar to the lining of the uterus find itself in other tissues, causing very small lesions, but that cause very severe pain. And it takes 11 years and multiple misdiagnoses for this woman to find out what's wrong and eventually being treated, costing the US healthcare system alone $120 billion per year. And you're probably thinking, we can image things. There's ultrasounds, there's MRIs. But both of those technologies, although advanced and wonderful, are not good enough and detect very small lesions, such as the one that happens in endometriosis. MRI, because they have very poor lateral resolution, and ultrasound, because it depends on a person actually holding the device and scanning as they're trying to figure out what's wrong. So meet Revilan, a robotic arm that connects to an existing ultrasound device that enables ultrasound from operator-dependent to operator-agnostic imaging, resulting in images that are 10 times higher in resolution than an MRI. So, how it works. Can we play the video? Okay, yay. So you see here the device, and it connects to an off-the-shelf ultrasound, no new ultrasound needed. And there's a robotic arm that the sonographer, now you see this green dot, they will use it in order to set the device, the scanning area, for the device. The device will send the images to Revilan that will combine those images into 3D image. And you'll see here on this left side what you will get with an MRI scan versus what you get with a Revilan, resulting in 30 times higher lateral resolution images that allow to diagnose very small lesions under 5 millimeters, saving years of diagnostics and burden pain and thousands of dollars. And you see here a competitive analysis. So the fact that we can automate ultrasound imaging brings us to diagnose small lesions, such as other imaging devices can't help. And you're probably thinking, AI can do this? And it can, but only when it has good images with high resolution that can actually see the small lesions. We already have great traction with several clinical partners, including a hospital-sponsored trial, LOIs from large networks such as Blue Cross Blue Shield and NHS, 2 pending patents, and eligible CPT codes. And you can see here a small quote from one of the potential customers that are really looking forward to place this device in every one of their clinics. We have a flexible B2B model with an ROI, expected ROI within 6 months to each site. The company has raised around $2.5 million, mostly non-dilutive funding from Israel, and are expected to reach FDA clearance by 2027 with a seed round of about $4.5 million. The company is built by several very experienced founders, Dr. Adas Siso that founded Tamar Robotics, Professor Moshe Shoham that founded Tamar Robotics, but also Mazor Robotics that exited to Medtronic, and others. And of course, supported by a very strong medical advisory board from hospitals across US and Israel. And although I talked about endometriosis, the approval will actually allow to scan all the area of the abdominal. So really providing solutions to early detection of cancer and other conditions of a billion-dollar market of around 25 billions. So if that sounds interesting, please reach out to me or directly to Adas so that no one suffers more than what they have to. Thank you.